You know that feeling maybe? That kind of unexpected, nagging discomfort? Somewhere you really don't want to talk about. Just a sense that something's off, but you're not sure what or even who to ask.
Yeah, that uncertainty can be really tough.
Well, if that sounds familiar, you are definitely not alone. Today, we're going to try and cut through some of that confusion. We're doing a deep dive into a condition that affects, well, a lot of men globally, prostatitis.
It really does.
Our mission here is just to bring some clarity, you know? It's common, but often really misunderstood. We've pulled together insights from a whole stack of sources. Medical doctors like Dr. David Letza, big health organizations.
Like the NIDDK, Mayo Clinic Urology Care Foundation.
Exactly. And even expert physical therapists, peak physical therapy, for instance. We're trying to give you that well-informed picture quickly.
A comprehensive view, yeah.
And honestly, this isn't some rare thing. Prostatitis is super prevalent.
It is. The numbers are quite high.
Over 25% of men get this diagnosis sometime in their life. Think about that. It's actually the most common urinary tract issue for men under 50.
That's a key statistic.
And it really impacts daily life, well-being.
Right.
It's a big deal. So let's unpack it.
Okay. So to really get what prostatitis is, you first need to understand the prostate itself.
Right, the gland.
Exactly. It's about the size of a walnut, a vital part of the male reproductive system. It sits just below the bladder and in front of the rectum.
Okay.
Its main job.
Yeah.
It makes fluid that goes into semen, which is essential for fertility.
Yeah.
And here's the key thing. It completely surrounds the urethra. That's the tube urine flows through.
Ah, okay. And that location, that sort of central position, that must be why inflammation there can cause such, well, widespread and frankly distressing symptoms, right?
That's a great point. It's precisely because the urethra passes right through the prostate.
Right.
That any inflammation or swelling can immediately mess with urine flow. That leads to those really frustrating urinary symptoms.
Makes sense.
And its closeness to nerves and other pelvic structures means pain can, radiate out, can affect sexual function, just overall comfort in your lower body.
So it's not just one spot feeling bad.
Not at all. It's more like a ripple effect through the whole area.
That makes so much sense. Okay, and here's where I think it gets really interesting. Because you hear prostatitis, but it's not just one single thing, is it?
No, definitely not.
You said it's more of an umbrella term. Why is that distinction so important? What are these different types?
Absolutely critical distinction. The National Institutes of Health, the NIH, they classify it into 4 main types. And Dr. Letza adds a really important 5th one, fungal prostatitis.
Okay.
And the reason this matters so much, if you mistake one type for another, well, the treatment could be completely wrong. You could be treated for months for something you don't actually have.
Wow. Okay. So what are they?
Let's break them down. First, there's acute bacterial prostatitis, ABP.
Acute. So sudden.
Sudden and severe? Yeah. It's a bacterial infection, often common stuff like E. coli. Think of it like a fire alarm going off. High fever, chills, aches, sudden, really intense urinary problems.
Sounds serious.
It is an emergency. Needs prompt medical treatment to avoid bad complications.
Okay. What's next?
Then you've got chronic bacterial prostatitis, CBP.
Chronic, so longer lasting.
Exactly.
Right.
Also bacterial, but it develops slower, lasts 3 months or more. It often shows up as like recurrent UTIs, but the symptoms are usually less severe than the acute kind.
So it comes and goes, maybe?
Could wax and wane, or just be kind of mildly but persistently annoying.
Right. And the third?
The third, and this is the most common one, is chronic prostatitis chronic pelvic pain syndrome, CPCPPS.
Okay, I've heard of that one.
Affects a lot of men, maybe 10 to 15% in the U.S.
Wow.
And the key thing here, the exact cause is often unknown. And importantly, it's not always a bacterial infection.
Ah, so antibiotics might not work.
Precisely. Imagine your body's pain alarm is just stuck on, but there's no obvious germ causing it.
That sounds incredibly frustrating.
It is. The pain is real, but finding the why is tricky. Could be chemicals in urine, immune response to old infections, nerve damage, even stress.
What did they used to call it?
Used to be chronic non-bacterial prostatitis or prostatitis. CPCPPS is the current term.
Got it. And number 4?
Number 4 is asymptomatic inflammatory prostatitis.
Asymptomatic meaning?
No symptoms at all. Guys with this don't feel anything wrong. It usually gets picked up by accident, during tests for something else, maybe a checkup or a fertility test.
So if there are no symptoms?
Good news is it usually doesn't cause problems and doesn't need treatment.
Okay. And the 5th one you mentioned, fungal.
Right, fungal prostatitis. Dr. Letza emphasizes this one. caused by a fungus, often Candida albicans.
Like a yeast infection.
Sort of, yeah. It often mimics bacterial symptoms, so it can be easily missed.
And how does someone get that?
It's particularly common if a man's sexual partner has recurrent vaginal yeast infections. It can kind of fly under the radar in the initial diagnosis.
Wow, that's a really important connection to make. So for you listening, the big takeaway isn't just memorizing these names. It's realizing that getting the type wrong could mean months of treatment that doesn't help.
Absolutely.
Especially if you get antibiotics for something like CPC-PPS, where bacteria aren't the main issue. It really empowers you to ask your doctor, are we sure which type this is?
Definitely ask those questions.
Okay, so given all these different types, it makes total sense that the experience, the symptoms can vary wildly too.
Hugely.
So for someone listening now, maybe wondering if this is what they're dealing with, how does this discomfort actually feel? What are the common signs?
Yeah, it's a wide range. Could be anything from just a dull ache to, honestly, debilitating pain.
Okay.
A common thread is definitely urinary issues. Painful urination, needing to go frequently, or suddenly feeling that urgent need. Often a burning sensation too.
Right.
Lots of men mention trouble fully emptying their bladder. Or maybe their urine looks cloudy. Sometimes even blood in the urine.
And blood is always a see the doctor sign, right?
Always. Don't ignore blood in the urine.
And the pain, it's not just in the prostate area.
No, that's the tricky part. It can show up in the abdomen, the rectum, the groin, lower back.
Wow.
Many guys describe discomfort like behind the scrotum or maybe at the base of the penis. And often pain or burning during ejaculation can happen.
Okay. And you mentioned fever and chills.
Especially with acute bacterial prostatitis, yes.
Yeah.
You might feel like you have the flu fever, chills, body aches, just feeling really unwell.
Any other signs?
Sometimes, yeah. Pus or discharge from the urethra. And unfortunately, sexual problems like erectile dysfunction can also be part of it.
You know, what's really striking is how much these symptoms sound like they could be other things.
Exactly.
Like a regular UTI or maybe even an STI. It must make figuring it out on your own almost impossible.
Very difficult, yeah.
Yes.
Self-diagnosis is really not the way to go here. The body signals distress in complex ways.
So what are the root causes then? Let's break that down.
Well, for the bacterial and fungal types, it's often fairly straightforward. Pathogens, bacteria like E. coli or fungi like Candida can migrate.
Migrate from where?
From the urinary tract, maybe the rectum, into the prostate. Sexually transmitted infections can also be a cause.
Okay, infection makes sense. But for CPC-PPS, you said it's often unclear.
Much less clear and way more varied. It could be things like chemical irritants in the urine itself, or maybe the immune system kind of overreacting to a past UTI.
Interesting.
Nerve damage in the pelvic area is another possibility, maybe from surgery or some kind of trauma.
Okay.
But then you have other factors too. Psychological stress plays a role for some. Tight pelvic floor muscles, even things like prostate stones, bladder stones, and enlarged prostate, that's BPH.
Benign prostatic hyperplasia.
Right. Or even a urethral stricture where the urethra itself narrows.
So many potential factors.
It really is complex. And, in rare cases, the symptoms might even mimic something more serious like bladder or prostate cancer, though that's less common.
This complexity just screams, see a doctor, doesn't it? For any of these symptoms.
Absolutely. Don't wait.
And you mentioned some urgent warning signs, things you absolutely cannot ignore.
Yes. If you find you absolutely cannot urinate at all, that's an urgency.
Okay.
Also, painful, frequent, urgent urination with a fever and chills, blood in the urine, as we said, or just severe discomfort or pain in your lower abdomen and urinary tract area.
Those aren't wait and see things.
Definitely not. Get medical help right away.
Okay. So diagnosis is key, given all this overlap in the different types. How do doctors figure out exactly what's going on? It sounds like detective work.
It kind of is.
Yeah.
And getting that precise diagnosis is crucial. It's not a quick guess. It usually starts with a really thorough personal and family medical history. Just understanding your background.
Makes sense.
Then comes a physical exam. That includes the digital rectal exam, the DRE.
Where they feel the prostate.
Exactly. A healthcare professional carefully feels the prostate through the rectal wall, checking for inflammation, tenderness, lumps, anything abnormal.
Okay. What other tests might be involved?
Quite a few, potentially. Urinalysis and urine culture are standard. They look for bacteria, white blood cells, signs of infection.
And the culture tells you which bacteria.
Precisely. Which helps choose the right antibiotic, if it's bacterial, or helps rule out bacteria for CPC-PPS.
Okay.
Blood tests can also show signs of infection or check things like PSA levels, though PSA can be elevated for many reasons, not just cancer.
Right.
Sometimes they might do a prostatic specimen test. They gently massage the prostate during the DRE to get a fluid sample to check for infection.
But not if it's acute bacterial.
Correct. Big no-no for acute bacterial because you risk pushing bacteria into the bloodstream.
Got it. Any other tests?
Yeah, depending on the situation.
Yeah.
Urodynamic tests can check how well your bladder and urethra are working, storing and releasing urine. Helps find nerve or muscle issues.
Okay.
The cystoscopy involves using a tiny camera on a scope to look inside the urethra and bladder, checking for blockages, stones, that sort of thing.
An ultrasound?
A transrectal ultrasound can show the prostate's size and look for abnormalities. But, and this is important, ultrasound alone cannot reliably diagnose prostate cancer.
Good clarification.
If cancer is a serious concern, a biopsy might be needed to take tissue samples.
Okay.
And sometimes a semen analysis is done, checking for blood or signs of infection in the semen.
Wow, that's a pretty thorough workup. And it really highlights that question. Without knowing the exact type and cause, how can treatment possibly be effective? It feels like shooting in the dark otherwise.
Exactly. That's why all this diagnostic effort is so vital. You need to pinpoint the target before you can treat it effectively. Otherwise, like you said, you're just throwing treatments at it, hoping something sticks, which leads to frustration and prolonged discomfort.
Okay, so let's talk treatment. Given the different types and causes, the approaches must vary quite a bit, right? Not just one single answer.
Absolutely not. It's definitely not one size fits all.
So for the bacterial types?
For bacterial prostatitis, both acute and chronic, antibiotics are really the main conventional treatment.
How long would someone typically take them?
For acute cases, often around 2 rinse, but sometimes it can be longer, maybe up to 6 or 8 weeks. For chronic bacterial prostatitis, it might mean lower doses, but for a much longer time, potentially up to 6 months to really clear it out.
6 months, wow.
Yeah, and really severe acute cases might even need IV antibiotics, meaning treatment in the hospital.
Now, you mentioned something really critical earlier about certain antibiotics, a warning.
Yes, this is definitely something listeners need to be aware of and discuss with their doctor. The European Medicines Agency put out a significant warning about fluoroquinolone antibiotics.
Which ones are those typically?
Common ones are ciprofloxacin, levofloxacin.
Yeah.
I recognize those names.
Okay. And the warning is about?
They're associated with potentially long-lasting, sometimes disabling side effects. Things affecting tendons, muscles, joints, even the nervous system.
That sounds serious.
It is. It doesn't happen to everyone, of course. But the risk is there. It's a really important conversation to have. Weigh the benefits versus those potential risks for your specific situation.
That's incredibly important info. Really underscores needing that dialogue with your provider. Okay, besides antibiotics for bacterial cases, what other prescription meds might help manage symptoms?
Sure, there are others. Alpha blockers, like silodosin is one example.
What do they do?
They work by relaxing the muscles around the bladder neck and in the prostate itself. That helps ease urination, makes it easier to go.
Okay, helpful for those urinary symptoms.
Definitely. Then you have NSAIDs, non-steroidal anti-inflammatory drugs.
Yeah.
Think ibuprofen, naproxen, for general pain and inflammation.
Right.
Muscle relaxants, maybe something like cyclobenzaprine, can help if there's significant pelvic muscle tightness or spasms contributing to the pain.
Which happens in CPC-PPS sometimes.
Exactly. And then there are neuromodulators, drugs like amitriptyline or pregabalin. These specifically target nerve-related pain, which can be a major factor, especially in CPC-PPS.
It's good there are options. But I know a lot of people are also interested in natural or alternative approaches. Do those have a role?
They certainly can, especially for fungal prostatitis or helping manage CPC-PPS.
Okay, let's talk fungal first. What helps there?
For fungal prostatitis, treatment often involves long-term antifungal agents. These can be prescription or they're natural options.
Like what?
Well, oregano oil is known for having pretty potent antifungal and antibacterial properties. Tea tree oil as well.
But you have to be careful with tea tree oil internally, right?
Extremely careful. Only under strict professional supervision and heavily diluted if used internally. Not something to experiment with.
Good warning. What else?
Probiotics are really key, especially after antibiotics. They help restore the healthy bacteria balance in the gut and, importantly, in the seminal fluid.
Ah, interesting.
In curcumin, that's the active compound in turmeric, some studies suggest it can help with chronic non-bacterial prostatitis because of its anti-inflammatory effects.
And you mentioned the partner connection before.
Yes, crucial point for fungal cases. If your sexual partner has recurrent yeast infections, you likely both need simultaneous long-term treatment to stop passing it back and forth.
That's a really practical piece of advice. Okay, what about natural support for CPC-PPS or just general prostate health?
Yes, several things come up often. Saw palmetto is quite well known.
What's that thought to do?
It has anti-inflammatory properties, and some research suggests it might help with hormone levels, specifically DHT, related to prostate health.
Okay.
Quercetin is another one. It's a powerful antioxidant found in things like onions and apples. It might help reduce pain and swelling.
Interesting.
Pumpkin seeds and their oil are often mentioned. They're rich in zinc and other compounds thought to be beneficial for the prostate.
Easy enough to add to your diet.
Exactly. Simple herbal teas, too, like green tea or chamomile, mainly for their anti-inflammatory properties.
Yeah.
And there's something called ryegrass pollen extract, sometimes known as Cernalton. Some studies suggest it might help manage CPC-PPS pain.
So, quite a few natural avenues to explore.
Definitely. Often used alongside conventional treatments.
And beyond supplements or herbs, what about just basic lifestyle stuff, things people can do every day?
Well, lifestyle changes can make a huge difference in managing symptoms and improving comfort.
Like what?
Simple things first. Warm baths, sometimes called sitz baths, where you just soak the pelvic area, or even just using a heating pad can provide a lot of relief.
Comfort measures.
Exactly. Also, for non-bacterial prostatitis, regular ejaculation might actually be helpful.
Really? How so?
The thinking is it helps prevent a buildup of prostate secretions, which can sometimes contribute to symptoms in those cases.
Interesting. What about diet?
Avoiding or at least limiting bladder irritants is key. Things like alcohol, caffeine, spicy foods, very acidic foods. These can definitely flare up symptoms for many people.
Makes sense. Cut down on things that aggravate it.
And conversely, increasing fluid intake, mostly water, helps flush bacteria out of the urinary system. Stay hydrated.
Good advice generally. What about bigger picture health habits?
Absolutely relevant. Things like weight loss if needed, adopting a balanced anti-inflammatory type diet overall.
More fruits, veggies, healthy fats.
Exactly. Increasing physical activity, finding ways to manage stress better. All of these help lower overall systemic inflammation in the body. And that's generally beneficial for prostate health and especially helpful for managing chronic pain conditions like CPC-PPS.
So diet, exercise, stress, the usual suspects for good health apply here too.
They really do.
Now, besides self-care, there are also specific therapies that can help, right?
Yes, definitely. Pelvic floor physical therapy is a big one.
What does that involve?
It's therapy specifically designed to address muscle tightness, trigger points, or spasms in the pelvic floor muscles. That's a really common contributor to pain, especially in CPC-PPS.
So working with a specialist physio.
A specialist pelvic floor physical therapist, yes. They use various techniques to release tension and improve function.
Okay. What else?
Biofeedback is another approach. It's kind of a mind-body technique.
How does that work?
It uses sensors to give you real-time feedback on bodily functions, like muscle tension. The goal is to learn how to gain conscious control over those responses.
Interesting. Could help relax those pelvic muscles.
Potentially, yes. Acupuncture is another therapy some men find helpful for pain relief. Uses fine needles at specific points.
Okay.
And we mentioned stress. If psychological stress seems to be a major trigger or makes symptoms worse, then things like cognitive behavioral therapy, CBT, or counseling can be really valuable.
Learning coping strategies.
Exactly. Developing ways to manage the stress response can directly impact symptom severity for some individuals.
You know, hearing about all these options, conventional meds, natural approaches, lifestyle therapies, it really points towards maybe needing a combination.
That's where the conversation is increasingly going, yes, towards an integrative approach.
Combining the best of different worlds.
Exactly. Combining natural and prescription treatments often offers synergistic benefits.
Like what?
Well, you might get more balanced symptom management because you're targeting different pathways of pain or inflammation. It can enhance immune support, maybe reduce reliance on heavy doses of certain medications, potentially lowering side effects.
And it feels more personalized.
It absolutely allows for more personalized care, tailoring the plan to the specific type of prostatitis, the individual's overall health, and their preferences too.
That makes a lot of sense. Now, if someone is on a treatment plan, how do they know if it's time to, go back and rethink it? What are the signs that might not be working?
Good question. There are definitely signs to watch for. If symptoms are persisting despite treatment or even getting worse, that's a clear sign to reevaluate.
Okay.
Also, if you're experiencing side effects from medications that are just intolerable that you can't live with, recurrent infections, despite treatment, that suggests something isn't fully clearing up.
Right.
Any new or unusual symptoms cropping up, or just a general feeling that your overall quality of life isn't improving.
So don't just keep suffering if it's not getting better.
Absolutely not. Bring those concerns back to your doctor. It might mean tweaking the dose, changing medication, adding another therapy, or even reconsidering the diagnosis.
It's also probably reassuring for people to hear that surgery isn't usually the answer for prostatitis itself, right?
That's correct. There are no surgical treatments specifically for prostatitis inflammation. Prostatectomy, the surgical removal of the prostate, is generally considered way over treatment for this condition.
But sometimes surgery might be needed for related issues?
In rare cases, yes. If someone has severe urinary retention that isn't resolving, surgery might be needed to, say, remove scar tissue in the urethra that's causing a blockage. Or sometimes pelvic pain might actually be coming from a completely different source, like a back problem. In that case, spine surgery might be considered, but that's treating the back issue, not the prostate itself.
Okay, good clarification. So just to kind of wrap things up, prostatitis is clearly common. It can be complex, lots of different causes, varied symptoms.
Yeah.
And getting that accurate diagnosis is step one, because the treatment really needs to be tailored.
Absolutely essential.
But the good news is there's a wide spectrum of options: conventional meds, natural remedies, lifestyle changes, therapies.
A lot of tools in the toolbox.
And hopefully this deep dive gives you, the listener, the knowledge to really have those active, informed conversations with your healthcare providers about all the options available.
Empowering patients is key.
So here's a final thought to leave you with. If we connect this to the bigger picture,
Okay.
we know that both bacterial and fungal infections can sometimes kind of hang around at low levels, maybe without causing obvious symptoms.
Right. They can linger.
And they can recur if treatment isn't fully completed or stops too soon.
That's a risk.
So it really raises an interesting question, doesn't it? How much might our day-to-day habits, our ongoing awareness, play an even bigger role in long-term prostate wellness and preventing these recurrences than maybe we've previously thought?
That's a really provocative thought. It shifts focus towards ongoing prevention and proactive health, not just reactive treatment. Interesting.